Welcome to the Deep Dive. We're here to take complex source material and make it really clear really fast.
That's the goal.
Today, we're diving into integrative care, specifically Chapter 36 from your mental health nursing text. So if you're getting ready for clinicals or just need a solid understanding of how non-mainstream care fits into psych nursing, well, you're in the right place.
And it's more than just a list of therapies, isn't it? It's really about a shift in thinking.
How so?
Well, conventional medicine, Western medicine, often looks at what's done to the patient, treating a specific illness.
Yeah, targeting the disease.
Exactly. Integrative care, though, flips that. It's fundamentally patient-centered. It really emphasizes the body's own ability to heal by looking at the whole person, physical, mental, spiritual needs, all of it.
Okay, that distinction's key. And to get there, we need the right language.
Yeah.
The term CAM gets thrown around a lot. Complementary and alternative medicine.
It does. But we need to be more precise, especially based on the text. There are really 3 definitions we need you to grasp.
Let's lay them out.
Okay. First, complementary medicine. That's using a non-mainstream practice along with standard medical care. Think using meditation while also taking prescribed antidepressants.
Got it. Standard care plus something else.
Right. Then there's alternative medicine. No, this is the one to watch out for. This is when someone uses a non-mainstream approach instead of standard medical care. Often, without strong scientific evidence or proper safety checks.
That sounds risky.
It definitely can be. Which brings us to the third term, and really the ideal we're aiming for in nursing, integrative care.
Okay.
This means using non-mainstream practices with standard care, and this is crucial in a coordinated, structured way that keeps the patient at the center.
Coordinated. That sounds like where nursing really fits in.
Absolutely. That coordinated, patient-centered approach aligns perfectly with professional nursing values.
This isn't some fringe idea then.
Not at all. Think about the history. Conventional Western medicine, it's only been the dominant model for, maybe 200 years?
Relatively new in the grand scheme.
Exactly. Whereas these complementary approaches, Cam, they've been practiced across the globe for thousands of years. And today, the numbers are significant. Up to 2/3 of people in the U.S. are using some kind of non-traditional therapy.
2/3. So nurses will encounter this.
Constantly. Which is why the ANA, the American Nurses Association, actually recognizes holistic nursing as an official specialty now.
Okay, define holism for us in this context.
Holism means seeing the person as a single, unified whole. It's recognizing how interconnected the biological, psychological, social, and spiritual parts of a person are. You can't just treat one piece in isolation.
So it really changes the assessment process.
Oh, completely. A truly holistic psychiatric assessment goes way beyond the standard questions. You have to ask about nutrition, exercise habits, the quality of their relationships, cultural background, religious or spiritual beliefs.
And crucially,
you must ask specifically about any herbal supplements or vitamins they're taking.
because people don't always volunteer that information, right? Why is that?
Right. Well, sometimes it's fear of being judged, or maybe they think the doctor won't approve, but people are drawn to these therapies. They want to be more involved in their own care.
Makes sense.
They might see these approaches as having fewer risks. Maybe they've had good experiences, or maybe they're just dissatisfied with how rushed conventional medicine can sometimes feel.
That feeling of not being heard.
Exactly. So they might keep quiet about the supplements unless you specifically, non-judgmentally ask.
Okay, so let's get practical. The source material groups these approaches into 3 big domains. First up, natural products.
Right. This includes things like botanicals, herbal medicines, vitamins, minerals, probiotics, things people often reach for to manage symptoms themselves.
And this is where we hit a major safety issue.
Yes. This is probably the area of greatest concern regarding safety. The regulation of dietary supplements in the U.S. is, frankly, quite weak, meaning there's no guarantee of purity or potency or even that the bottle contains what the label claims. Now, it's true that statistics show far more fatalities linked to prescription drugs than to vitamins or herbs.
Okay, that's interesting.
It is, but the lack of oversight for supplements is still a serious problem. You just don't always know what you're getting.
Which means interactions are a huge risk, especially in mental health, where patients are often on multiple meds.
A massive risk. And nurses have to know the big ones. The text highlights several, but let's focus on 3 critical ones you absolutely need to remember.
Yeah, hit us.
First, St. John's wort. People take it for depression, often mild depression, the danger. Combine it with standard antidepressants or triptans for migraines or even methadone, and you risk serotonin syndrome. which can be fatal.
That's serious.
Very. But there's another huge risk with St. John's wort. It speeds up the metabolism of other drugs.
Meaning they don't work as well.
Exactly. It can make crucial medications like oral contraceptives or drugs for HIV much less effective.
Wow, okay, that's a huge patient education point, especially the contraceptive interaction.
Absolutely critical. Second major one, kava, often used for anxiety or sleep problems.
What's the risk?
It's hepatotoxic. It can cause severe liver damage. We're talking liver failure, need for transplant in some cases. It's banned in several countries for this reason.
Okay, kava, liver toxicity. Got it. And the third?
Ginseng. It has anticoagulant effects, meaning it thins the blood. If a patient is already on a prescription anticoagulant, like warfarin, adding ginseng dramatically increases the risk of serious bleeding.
St. John's wort, kava, ginseng.
Got it.
Those are critical safety flags.
Definitely. But it's not all risk. Natural products, especially nutrition, have proven links to mental health.
Right, the text connects nutrition and mental health outcomes quite strongly.
It does. We know psychiatric patients often have nutritional issues, and research is really backing this up now. For example, studies using the Dietary Inflammatory Index, or DII. It measures how inflammatory your diet is. Higher scores mean more processed foods, refined sugars, unhealthy fats, basically, a pro-inflammatory diet. And higher DII scores are linked to more severe depressive symptoms.
So what kind of diet helps?
The evidence points towards anti-inflammatory diets. Regular meals, lots of fish, fruits, vegetables, and especially omega-3 fatty acids. These have shown reduced risk of depression.
Omega-3s seem to come up a lot.
They do. There's good trial evidence for omega-3s in both depression and bipolar disorder. Vitamin D is another one. Supplementation seems linked to improvement in depressive symptoms, possibly by reducing inflammation and oxidative stress in the brain.
Interesting.
And we can't forget the microbiome. That gut-brain connection is huge. The bacteria in our gut seem to play a really significant role in regulating mood, anxiety, depression. It's a rapidly growing field.
Okay, let's move to the second major category from the text, mind and body approaches.
Right. These are techniques that tap into that powerful connection between what's happening in our mind and how our body functions. And honestly, many of these are pretty mainstream now.
Like what?
Well, meditation and mindfulness, for starters. There's solid evidence supporting their use for depression, anxiety, even chronic pain management. They're common in psychiatric settings.
Makes sense. What else?
Yoga. It's more than just stretching. It combines physical postures, breathing techniques, and meditation. Physiologically, it helps lower cortisol, that's the stress hormone, and it helps stabilize the HPA axis.
The HPA axis.
Yeah.
That's the body's main stress response system, right?
Exactly. So yoga can help regulate that system. And then there's exercise.
Ah, yes, exercise.
Mhm.
Simple, but so important, especially for psychiatric patients who might struggle with energy or motivation.
It's incredibly powerful. Think of it as applied neurochemistry. Exercise changes levels of key neurotransmitters, dopamine, serotonin, norepinephrine, and crucially, it boosts BDNF, brain-derived neurotrophic factor.
And BDNF is vital for
brain health, neuroplasticity, growing new connections. The text specifically points out benefits across different conditions. For substance use disorders, exercise can help with abstinence, reduce withdrawal symptoms.
Wow.
For schizophrenia, it can lessen symptoms, improve cognition. For kids and adults with ASD or ADHD, it can improve focus and cognitive function.
That's compelling evidence. What about other mind-body techniques?
The text mentions acupuncture. That involves placing fine needles at specific points, called meridians, on the body.
To modulate ki.
Yes, the idea is to influence the flow of ki or life energy. It's used pretty widely for pain, but also for helping with substance withdrawal and managing emotional distress.
And guided imagery.
That's using mental visualization as a therapy tool. Really helpful for anxiety, pain, working through trauma, PTSD symptoms, helping the mind create a calmer internal state.
Okay. And this domain also includes things like chiropractic.
Yes, the manipulative practices. Chiropractic medicine focuses on the relationship between the body's structure, mainly the spine, and its function. They treat misalignments or subluxations. While known for back pain, it's sometimes used for anxiety too.
And massage.
Massage therapy definitely has proven benefits for stress, anxiety, and depression, including during pregnancy.
The text mentions specific techniques nurses might hear about.
It does. The 4 basics are good to know. Effleurage, those long, smooth strokes, petrissage, the kneading movements, vibration percussion like tapping, and friction or deep tissue work. Just knowing the terms helps communication.
All right, that brings us to the third and final category in the source, other complementary therapies. What falls under this umbrella?
This is a bit of a catch-all. It includes things like aromatherapy.
Using essential oils.
Exactly. Oils like lavender, chamomile, neroli, they're either inhaled or applied to the skin, usually diluted. The idea is that smell directly impacts the brain's emotional centers and the involuntary nervous system.
So calming or stimulating effects.
Right. Lavender, for example, shows promise for things like postpartum anxiety and mood issues. But safety is key here.
How so?
These oils are potent. They absolutely must be diluted before putting them on the skin. Never take them internally. And patients need warning about photosensitivity. Some oils make your skin highly sensitive to sunlight, risking bad burns.
Good points. What else is in this category?
Expressive therapies. Think music therapy, art therapy. These are really valuable in mental health recovery. They offer nonverbal ways to process emotions and experiences.
The text had that interesting study about nursing students.
Oh yeah, the blood draw study. Just listening to music significantly cut anxiety and actually improved their performance doing their first blood draws. It's a small example, but it shows the tangible impact.
Definitely. Then there are energy therapies.
Yes, these are based on the idea of bioenergy fields around the body. Includes things like therapeutic touch, where the practitioner uses hand movements, often without actually touching, to balance energy fields.
And healing touch.
Similar concept. A derivative of therapeutic touch, but often involves gentle, light touch with the intention to heal. And Reiki, which involves channeling universal life energy, often through the hands, to promote healing, reduce pain, ease anxiety.
Okay. And finally, the text touches on whole ancient systems of medicine.
Right. Very briefly, it mentions traditional Chinese medicine, or TCM. This system is rooted in Taoism, emphasizing harmony. Health is seen as a balance between yin and yang opposing forces.
And qi again.
Yes, treatments like acupuncture, herbs, qigong, tai chi, they all aim to ensure the smooth flow of qi, or life energy.
And the other system mentioned.
Ayurvedic medicine from India, very ancient. It views the body as made of 5 elements that combine into doshas, or vital energies. Health is about keeping these doshas balanced through diet, herbs, yoga, meditation.
So the common thread seems to be balance and harmony.
Exactly. Whether it's yin and yang or doshas, the fundamental goal in these ancient systems is achieving equilibrium within the person, mind, body, and spirit. Hashtag outro. So, pulling this all together, what's the bottom line for you, the learner? We've walked through the 3 main domains: natural products, mind and body practices, and these other therapies.
Right.
The absolute core message for nursing practice is this: you have to know about these modalities. It's essential for doing a complete, truly holistic assessment, and it's your job to educate patients safely.
Guiding them to good information.
Precisely. Point them towards reliable resources, like the National Center for Complementary and Integrative Health. The NCCIH website is a great start. Don't just leave them navigating this alone.
Absolutely. And that brings us to a final thought, something to chew on. The source mentions how certain groups, like the Amish example, might rely heavily on traditional or natural remedies first, sometimes delaying conventional care until a relapse occurs.
A common scenario, unfortunately.
So, given that reality, where patient choice might lead them down paths without conventional oversight, here's the question. What could our healthcare systems do differently? How could hospitals or clinics better integrate licensed, non-mainstream providers with conventional ones to create a truly seamless, safe continuum of care? How do we bridge that gap between philosophy and the practicalities of delivering care?
That's the million-dollar question, isn't it? Bridging that gap safely and effectively.
Something for you to think about. Thank you for joining us for this deep dive into integrative care. We hope this helps clarify these important concepts for your practice.
We'll see you next time.